Dr. Mike Roskies, welcome to the show. Tell us,
Thank you.
tell us a little bit about you, your practice, what you specialize in, and then we'll
Sure.
get started with some nitty-gritty questions.
All right. Well, thanks for having me, Lauren. It's really a pleasure to be here. I've been listening to the podcast for a long time, and we'll get into this, but my wife loves your content and loves you. So when I saw that you were hosting it, I thought it would be such a great opportunity for us to have a conversation and learn from one another. Um, So for me, yeah, I'm Mike Roskies. I'm based here in Toronto, Canada. I graduated residency about 6 or 7 years ago now. I did two fellowships afterwards, one in head and neck reconstruction at the Cleveland Clinic, and then I did a facial plastic and reconstructive surgery fellowship at the University of Toronto. I'm originally from Montreal, had planned always to go back to that city. But once we left our little pocket and our little bubble and saw the world outside of Montreal and really fell in love with the city of Toronto. We realized that it would be a great opportunity to start fresh. We were pregnant with our first, and so I decided to stay in Toronto. After my fellowship, I joined the practice right away, set up shop. A couple years after that, by buying into my own practice with a partner who does exclusively body surgery, which is called Yorkville Plastic Surgery Center. And yeah, so I'm a facial plastic surgeon. I really love everything about what I do. And I suppose that's what we'll talk about today. But I have two boys, almost five, almost three. And that's it. That's me in a nutshell.
I love it. There are a lot of similarities, I think, between us. One is that we have two boys.
Mhm.
We both have an athletic background. Another thing that I noticed, you mentioned a little bit of your training. You did undergrad, medical school, and residency at the same institution, as did I.
Mhm.
And I still remember when I matched there for residency, my dad was like, I don't know if you're a thoroughbred or an inbred, but
Yeah.
congratulations.
Absolutely. Yeah, so I trained at McGill University. I did medical school, residency, undergrad there as well. I lived 15 minutes away from there. It was a commuter school for me, and I still felt that that was maybe too much of a commute. So when I matched into started medical school, I moved literally right next door at a time that virtual classes were actually becoming quite popular. So I literally never moved. Even a block to be able to go to medical school, except of course during clerkship. So it was very convenient. I loved the school. I loved the downtown campus of McGill, and yeah, I absolutely miss it.
So tell us, you mentioned that you did a head and neck fellowship at Cleveland Clinic first.
Mhm.
What was your journey in becoming a facial plastic surgeon? Was this always the plan? Did you kind of discover new loves during the way? How did that all evolve?
Yeah, I loved plastic surgery. I remember even as a young kid, like most, seeing the show Nip Tuck and really falling in love with, I think more so the lifestyle surrounding it. And when I was a medical student interested in plastic surgery and reconstructive surgery altogether, I remember meeting with a very well known, very well established plastic surgeon, just asking some preliminary questions, trying to figure out exactly where I wanted my career to go. And I felt like I was just talking to an alien, like somebody from a different planet who could not relate to me at all. And I contrasted that to my first OR I ever saw was a prostatectomy with a reconstructive surgeon who was 6 feet tall and probably 250 pounds, just this jovial guy who was blasting music in the background. And I fell in love with the people more so than the actual specialty. And I felt that that's who I could become and who I wanted to be. So, really from the beginning of medical school, I wanted to be a head and neck surgeon, a head and neck reconstructive surgeon, and that evolved, of course, over time. At one point, I thought I would be a face transplant surgeon, and that was something very popular at a time that I was doing my training. And Cleveland Clinic was really one of the big centers in the US, having done probably one of the first, I think, partial face transplants at the time. And so that became my goal very early on, um, was to get that training, immerse myself in that environment. And I realized I hated it. I loved my fellowship. I loved my training. I loved working with my mentors, and I still keep in touch with them. I'm giving grand rounds at Cleveland Clinic in a couple of months, but I hated the hours. I loved the surgeries, but I didn't like anything else accessory to that. I felt that we were really treating patients who were, I don't know, maybe not able to communicate as well with us. The surgeries were very long. Their outcomes were, or outlooks on life were not necessarily as good as we wanted them to be. So I think selfishly, maybe a little bit unselfishly, to be part of our patients' journeys, I just fell back on cosmetic surgery, which I really always loved. And very early on in that fellowship, I just fell in love with the surgeries themselves. I loved the ability to make my own schedule and kind of create my own life. So it was kind of a no-brainer from then on.
For those that aren't intimately aware of what the reconstructive world is when head and neck surgery, give them a sense of what were the hours that you hated and
Yeah,
how do those cases occur? Talk about the patient population and some of the challenges that come along with traumatic and malignant processes of the head and neck.
that's right. So, as a fellow at the Cleveland Clinic, I served as almost a junior staff. Um, and in that capacity, I was on call for about 7 or 8 weeks that year. Um, during which we did a lot of facial trauma. Many of those patients were involved in motor vehicle accidents, but a lot of the times it was mostly just drunken fools falling on their faces and injuring themselves. And that was, the surgeries again were very cool, but it's unsatisfying work because you don't get to see those people in follow up. You don't get to know what happens to them long term. And that was matched with, of course, the bread and butter of the fellowship, which was head and neck reconstructive surgery, doing a lot of free flaps. In my year, we did 100 some odd free flaps. It was very, very busy. My hours were 6 a.m. to sometimes 2 a.m. I remember being the first car arriving and the last car leaving in the parking lot every single day. And, it's this hedonic treadmill that you're kind of on, and you never really get a pause. You're married to the work. You're constantly involved in surgeries and patient care. And even still, I constantly felt the guilt that I wasn't doing enough as a fellow when I was there. And it was a very weird kind of in between to exist in. Um, and what really kind of solidified I don't know, my disinterest in the specialty altogether was when you become a staff and you become involved in those patients' lives and their cares, which is different than when you're a fellow or even a resident, where you get little snippets of their lives. You're involved in their surgery, and when they're recovering from surgery, they're not really speaking to you. You don't get to know too much of their lives. But as a staff, when you see them in follow-ups and you understand that you're not solving all their life's issues by taking out their cancer and hiding it with a free flap, the suffering and the struggle is still ever present with them. It's just, you take that home, it weighs on you constantly. So emotionally, I just don't think that I was built for that.
On the flip side, there is a lot of stress that goes along with doing cosmetic surgery on
Mm-hmm.
patients, ensuring that preoperatively they have realistic expectations with what you're going to give them. Operatively trying to optimize every single maneuver to give them the best outcome. And then afterwards, walking them through this huge process of recovery. So let's fast forward a little bit into some of the different challenges that you face with more cosmetic procedures and that
Yeah,
patient population.
sure. I had a medical student observe me the other day, and she goes, "So nice to see how so early on you're so successful in your career." And I said, well, I'm only so successful because I failed a lot. Um, and that's the truth. But most people don't see that. You hit your stride at a time where people are starting to notice you and notice your work, but they don't see the 3 years prior where you struggled for a very long time with every aspect that you had just touched on, both preparing patients for surgery, technically carrying out the procedure, and then constantly being available for them um, and for their families. That's a hard thing to manage. I remember when I first started out, I was literally I had a different email address crafted for who was my patient care coordinator, but frankly, it was just me reaching out to patients beforehand, getting them to sign documentation. I was very present in my patients' lives. They all had my personal cell phone number, which I no longer give out. And I think that's something we can talk about, is the evolution of me setting up boundaries with my patients. Um, but it's amazing how far reflecting on the last 6 years, how far I've come, and I'm proud of it for sure. But it has absolutely been a struggle. It's not easy.
Yeah, and I for the listeners, so I'm younger in my career than Dr. Roskies, and I have reached out to him a couple times, and the struggles are really there. I think professionally we're all selfishly wanting the best outcomes. I mean, yes, we want the best outcomes for our patients, of course, but selfishly we want to be the best that we possibly can be, the best in our field. Talk about that growth as a surgeon and how you, I mean, did you just go home and ruminate every night about the case you did that day and the lady you saw in follow up who's 1 week out, who's worried about some little ripple or pucker? I mean, how was that initially, and then how is that now? And are you where you want to be with all of that stuff, or do you see that you're still continuing to evolve and improve that, I hate to even say the word balance, but that
Mhm.
aspect of the field that we're in?
Sure. I think the second you stop taking those thoughts home with you is the second that you no longer offer the best possible service and outcomes in yourself to your patients. Uh, we are in this field, which is very competitive, both to get into, but also to exist in and to thrive in because of who we are. We are absolutely type A personalities who are not used to failure. Uh, and I think that, especially at the beginning of my career, there was no question. I relived moments of surgery. I relived patient interactions many more times than the only time it occurred. And you take it home with you and it eats you alive. But it's what teaches you how to be more resilient and how to be better and how to grow. And yeah, I think that is just part of what I like to refer to as the sequence. So, you talked about trying to be the best. I think you really only can be the best version of yourself, having learned from people who are the best versions of their selves. The guy who wins the Nobel Prize in math doesn't talk negatively about the elementary school teacher who taught him arithmetic. You still have to go through that sequence. You have to learn the basics from your mentors or people who you once looked up to in order to build upon that and to take it one step further. So um, it's just part of the process. The sequence is meant to be there for a reason, but the second you think that that sequence has ended is the sequence you no longer offer that great service to people.
Yeah, that's pretty incredible, having that healthy hunger for yourself, but also just a true and deep appreciation for everybody that helped you get to where you are today.
Yeah,
What Give us a sense of your average week right now.
sure. It's busy, busier than I would like it to be. And of course, I'm speaking now from a position of privilege, where we have built up a business that is getting a little bit too busy for my liking. And although
Pause there and tell us what
yeah,
does that mean, too busy? Like, because for some of the younger surgeons or younger
yeah,
injectors, or I mean, we can't even
for sure.
imagine being too busy. What does that mean to you?
Surgery is not just physically taxing, it is emotionally draining. There's only so much that you can give to one patient, to one staff member, to members of your family, right? You have this limited resource of not just time, but attention. I think that is our greatest limited resource, is where you spend your attention. And for such a long time, I gave everything to my business. I gave everything to being the best version of myself. And then I would come home and fall asleep on the couch. And I had two young kids. And I feel a little emotional talking about this, but I've debriefed about this quite a bit with my family and my staff. If only I gave my relationships as much attention as I gave my business in the last few years, I think I would be a much happier person. And I think that I hit this period where, like I said, I'm now in a position of privilege where we are having trouble keeping up with the demand for surgery. We'll talk about that. And now I get to kind of shift the gears a little bit and talk about what I want and talk about how I can spend that limited time and attention to building what I really wanted. Because the idea of me going into facial plastic surgery was to build the life that I wanted, not just the practice that I wanted, not just the specialty or the business that I wanted. It really was to craft that balance between my business and seeking fulfillment from a professional level, but also being the best dad that I possibly could be. I grew up without a dad. My dad passed away when I was 3 years old. I live with this guilt of trying to be there for my kids in a way that, I did not have. And so there's really, this is a heavy topic, obviously, but in simple terms, I just want to be able to spread that attention more evenly into every aspect of my life. Um, because no matter how much surgery you do, it's not going to fill some void. And when you pass or when you leave your legacy, nobody's going to talk about how many facelifts you did.
I that so resonates with me. I mean, it
Yeah.
is a lonely struggle, and I'm the same way. I right now feel like, and I've had the same exact conversation with my husband. I feel like I give 99% at work and I come home and I give 1% to him and my two kids. It is not fair to my children and my spouse. But
Mm-hmm.
I think it's more common of a problem than most people are willing to talk about, or even, I mean, recognizing it in your own world is I think the first step. What you mentioned that you guys are kind of at capacity or over capacity with
Mm-hmm.
volume. How do you work through choosing patients or triaging things?
Yeah.
Do you just raise your prices and they self-select? How have you guys kind of played around with that? I hate to call it a problem, but it's just a
Yeah.
challenge.
Yeah. It's a challenge. It's a little bit of everything. We um, have tried very hard to keep up with or reduce our wait list. I think that it is unfair, and you will eventually lose good patients if your wait list is over 6 months. And we're trying to get it to 3 to 4 months, and it has been a struggle. And it's just a law of the universe. If you raise your prices, people are going to want to do surgery with you more. So we've tried. We have. I have gone up on my pricing. This is a business podcast, so I feel comfortable talking about this. We've gone up 35% on our pricing in the last 12 months, and it's been not all at once. It's been 5% at a time. Every single time our waitlist has reached that capacity. Um, so I don't know if that works very well. I think setting up boundaries is very important. And something that has served me well, which I've only really come to realize very recently, is we're trained in this. These are board exam questions like red flag patients. Simon, as an example, single immature male who's overly expectant and narcissistic. I still remember that. We're trained to think of the red flags and the people that we don't want to operate. And we spend many parts of our consult asking questions around that, trying to parse that out. I think what I've tried to do more recently, which has served me very well, is the exact opposite. We've actually developed an ideal prototype of patient that we want to operate in specific scenarios for specific surgeries. So we've crafted this, and my consultant will come out of the room after having done the first part of the consult, and she'll know. She's worked with me for a while now. She'll know exactly if I want to operate on that person or not, based off of that positive prototype that we've developed. If somebody checks all the boxes, it makes my life super easy. I know that they're going to fly through and do very well after surgery. And not everybody checks every single box, but we're trying to check some of them in order to go forward with it.
So the folks that don't check hardly any, how do you navigate that discussion? Do you
Yeah.
refund their consult fee? What I would imagine that's a little uncomfortable.
Very uncomfortable. We do not charge $1 for consults. So every single one of my consultations is free advice that I offer to patients. If I don't feel like I can offer them what they're looking for, we shift gears. And in the second half of the consult, we actually talk about what they are looking for. And I may make recommendations for surgeons nearby that can help them accomplish whatever goals they're looking for. Um, that's part of my philosophy as we, it's an amazing marketing technique. It's called positioning as a service. And it's really guided me very well in my career and my practice, in that I may not be able to offer what everybody is looking for, but at least I can guide them and offer them some professional advice towards that. So our consultations are no charge. I think that takes a little bit of the pressure off. um, I do not fare very well with saying no to patients. We have a keyword that I'll use in my consultations, and my coordinator will sometimes help navigate that discussion. I will not say that keyword in case there are patients listening right now. Um, I've tried every tactic under the sun. There's a group of surgeons that we're all part of online. Somebody made an amazing recommendation to talk about intuition, and to say that, you turn to your patient and you say, do you believe in intuition? And they'll turn back to you and say, yeah, of course I believe in intuition. And your next answer should be, well, so do I. And my intuition is telling me that I shouldn't operate on you. And I used that 2 weeks ago on somebody. And I was just so impressed at how it stopped the conversation in its tracks. She no longer pushed me to have surgery with her, but then she went home and she left me a 1-star review. So there's no great way of navigating that discussion. I think it really is person specific, but yeah, it's hard saying no. It is hard saying no.
Yeah. Safe words and 1-star reviews. Speaking of reviews, early on in your career, either when you were with the other group or when you and this body surgeon started, how did you start building your reputation for all the new people out there who are trying to build a good reputation in their community online? What did you find the most helpful? Did you find it was Yelp reviews or patient testimonials that you put online? Was it you opening your phone and making some Instagram reels? What has worked for you?
I should be asking you that question. I think you're doing such a great job, far better than I ever did at showing your true, authentic self online. And I think that's what it really comes down to, is just being yourself and attracting the patients that you would want to operate on. That's part of the process too, is, there are some patients who are expecting something completely different when it comes to aesthetic goals or just overall environment and experience in clinic. And when they meet me, and like, I very purposely don't wear a suit to clinic. I don't wear a white coat even. Like, I want to be the doctor that, I would want to have. I want to be very approachable. I want to be very laid back. I want this to not be a very ostentatious or, too much of a luxury feel when patients come in, because that's just not who I am. um Sorry, there was a second part of that question.
Just what's worked marketing wise when you were
Oh yeah.
building your
Yeah.
reputation?
Yeah, sheer luck. Truthfully, I think it comes down to, and I can think of every single one, it's just a handful of patients that will be your advocates online or to other friends. There was a girl who texted me 2 days ago to say, my cousin's coming to see you for her nose. I'm just so grateful that you did mine. That girl has sent me probably 30 people to do their rhinoplasties with me. There is no Google AdWord. There is no reel on Instagram that you can make or pay for that will generate that solid word of mouth. So it just comes down to offering the best possible service that you can to every single patient, not expecting anything in return. But you really do have to have those champions for you who will leave you the reviews, allow you to post their photos, allow you to share their stories, which I think is really what people are interested in now, is motivations behind surgery, the recovery process, how people felt about their, I don't know, I guess, relationship with you. all of those things matter, and you can't orchestrate it. It just kind of happens over time.
Yeah, the recent story that you shared on Instagram was really pretty impressive. One, with the
Thanks.
patient's history and what she had gone through. And then two, as a surgeon, I love when other surgeons share the healing phase. It's good to show bruises and swelling and puckers and pleats. And I think that I purposefully show all that stuff during the consult before someone decides to take the plunge. But
Mhm.
I think putting out on social media just allows patients that much more reassurance
Yeah,
after the fact when they do look a little crazy those first few weeks.
for sure. Because that's the patient you're going to attract. I don't want that patient who, will send me their selfie from a Middle Eastern country 6 months after surgery with heavily, a heavy filter or tons of makeup, because it's not the reality. Maybe the surgeon's proud of that, but I think it really does a disservice to prospective patients in the industry as a whole, frankly, because this is medical surgery with medical risks that people need to be aware of when they come to see us.
What are your patients probably most surprised about, after the fact? Eh, you're championing the preservation facelift. Your neck
Mhm.
lift results are really phenomenal.
Thanks.
So for the face and neck lift patients, what are some things that maybe they wish they would have known before taking the plunge, or maybe things that they may tell their friends before their friends come to you?
Yeah, I was trained in, I think I was trained in an age where social media was less present and people had a little bit less education when it came to cosmetic treatments. And I take some of that approach in my consultations where I sometimes just recommend or talk about what my patients are coming in asking about. And more often than not, that goes totally fine. And, they're coming in because they don't like their jowls in their neck. And so we do a lower face and neck lift. But sometimes after that's done, they start to focus on their lower eyes and feel like those look worse, or they feel that it doesn't match the upper third of their face as well. So some of the best surgeons in the world do this very, very well. And I'm still trying to figure it out. And we do have a little bit of a formula in clinic, but I think really asking permission to make recommendations about things that they may not be asking you about is a great way of at least introducing the potential pitfalls of focusing narrowly on one aspect of their face. So for me, my most common surgery that I do after lower face and neck lift are under eye surgery and brows. Um, so much so that we've kind of incorporated our brow lift into our stages of surgery. And so it allows us to educate patients, no matter who they are on their first phone call, they know that we approach several problems of the face in a very systematic way. And so at least they're aware of what exists as options, because sometimes patients don't even know. Most of the time, they come in very well educated. And that's the flip side of the coin, where you really do need to be judicious in what you recommend, and recommend what's best for them. But that's, I guess, the different side of the coin.
Give us a sense of your office makeup. You've mentioned that there's another surgeon that does a lot of body
Yes.
work. You've mentioned
Mhm.
that you have someone help you specifically with the surgery consults. Who else do you have at the office?
So we divide our practice into medical and business. So I have a practice manager who runs all of the clinical side of things. She's a nurse. She is that nurse that you see as a resident in the hospital, where you target them and say, when I start my practice, I'm going to hire you. She's better than that. She's better than I could have ever imagined. Um, and so she started with us, and very early on, without her even coming to me and asking for something different, I asked her to be my practice manager and run everything. Um, so that's been a godsend. The business side of things is run by my wife. She is outside of the office. I keep her away from the politics. She and I both like that aspect of it, because I have been um, I've been in practices where families were involved, and I think that's just unfair for employees. So my wife runs the business aspect of things, which involves marketing, social media, the financials of everything as well. Um, my office is a surgery center with two operating ORs, one which is a little bit more full scale than the other. So we use that one for our GA cases. My partner operates 2 days a week. I operate 3 days a week. So we split that specific ORs. I'll do hair transplantation in the other OR 1 to 2 days a month, just for friends or husbands of my patients in that one. And yeah, we have some shared employees. Of course, we employ a staff of 15 casual nurses in the OR. It's a big production back there. We have an executive assistant who also serves as administration and reception, as kind of a jack of all trades. And then we outsource all of our financials and accounting to a company.
Anesthesia wise, do you have someone that contracts with you or someone that's employed by you?
Yeah, it's an interesting environment here in Toronto. This far predates me, but many of the hospital anesthesiology groups band together and serve specific practices. So it's an amazing um, service that they offer us, because we'll always have somebody available, no matter how short notice we let them know that we have a case going. So, one anesthesiologist kind of controls the schedule, but it's a rotation of about 6 or 7 from Toronto General Hospital that serve our patients.
That's incredible. And what percentage of your surgery patients travel to you and how does it work? I know there was some discussion recently on our group about patients from other countries.
Mm-hmm. Yeah. Um, Touchy subject, because we do get a lot of inquiries from the US, especially for surgery, and it ebbs and flows. There are times where we just universally shut people down. The problem is that you do have to carry extra insurance, not just for yourself, but also all of the ancillary staff in your office, including the anesthesiologist. So it can be quite pricey. We have basic insurance through our Canadian Medical Protective Agency that all physicians have to pay for in Canada, and that will cover you for any malpractice. I think concerning other Canadians, so they wouldn't cover us if somebody traveled to Canada to have surgery. We do all internationals. I would say my practice, because Canada is, it's a large country surface area wise, but it's small from a city standpoint. There are many people who fly in from across Canada to have surgery with me. I would estimate it's probably about 50% now, which is not small. We do see people from outside Toronto all the time. And then, from time to time, if patients have family members in Toronto, we'll definitely accept to operate on them. Because for me, it's not a question of malpractice at that point. It really is, in the event of a complication, do they have somewhere to stay for a prolonged period of time? So it's kind of, our investment in them should also be an investment back in us, and that involves the post care. So case by case basis, that's how we're treating it right now.
I've recently started seeing some traveling patients, and there is a lot of pushback about asking people to stay for
Mm-hmm.
even a week and a half. And I think that, you know, being transparent on the internet, talking about complications is helpful because it
Mm-hmm.
happens. Every one of us has complications. It's devastating. You mentioned really the shift from being like a resident and a fellow to then being the one in charge. And you mentioned how great it is to follow these people and get to know them. I would say on the flip side, it's also a lot more stressful than I
Mm-hmm.
thought it was going to be. And I remember my attendings talking about that. And I was just like, yeah, whatever. I'm sure it'll be
Mm-hmm.
fine. But it really does weigh on you when patients have small hiccups and big hiccups. I don't know if you want to speak to that at all and how you've
Yeah,
grown professionally in terms of
sure.
allowing yourself to accept a small
Yeah.
percentage of complications.
Yeah. I finished a 9 hour case yesterday, and my nurse comes into my room and says, I saw somebody today and she just didn't look great. There was something weird about her skin, and she was very early after surgery. And she didn't have any photos, but she said, I really want you to see her. I think she's close by. I'm going to give her a call and have her come back. Um, Turns out she's an actress on TV. She is a very well-known figure here in Canada. And I did an isolated neck lift on her 10 days ago. And she had a massive hematoma. It looked terrible when she came in to see me. So I'm just sitting there milking this hematoma out from her face. And she is the nicest, sweet. She's a comedian. She's just hilarious and took it completely in stride. And thank God she did, because, I was devastated that that had happened. But I also have come to appreciate that my consults are really centered on almost trying to convince patients why they shouldn't have surgery with me rather than why they should. And we focus a lot on complications. I show my worst outcomes to some patients that I really think are showing me that they can be unrealistic with their expectations. I have a little folder on my iPad. It's not named anything, but I will show them my worst outcomes so that they can self-select themselves out. Um, it comes with the territory. You'll have the best days and you'll feel like you're the king of the world, and then something will humble you within a split second right afterwards. So I think it's really important to just keep an even head about everything. And by the way, we didn't touch on it, but we almost did with reviews. I no longer, I think, by the way, you're doing a great job. And at the beginning, I showed all my reviews, and there's no doubting that patients will find me because of my positive reviews online. But I tend to focus on them less. I don't post positive reviews that I get online anymore because I don't want that positive validation to prove to me that I'm a good surgeon or that I care about my patients. Because you know this just as well as I do. When we get a negative one, we feel like we're the worst surgeon in the world, unless, of
Mm-hmm.
course, sometimes you just can't catch all patients, um, or self-select or select out the ones who maybe a little bit unrealistic with the expectations and outcomes from surgery. But I just try not to let that influence me. And of course, we're all human and it still does, but it affects me less. I'm able to separate a little bit more as time goes on. And that's just a question, again, I think, of the sequence and just allowing that to evolve.
We've talked a lot about like struggles and challenges and you could say failures or complications. Do you think that your history as a triathlete has lended to some of your success in that way? And I think are just so valuable in every way of life. Do you think your previous life is lending towards your success today?
I'll answer that with, I start every single interview that I give, whether that's for a staff in my office or a resident or fellow that I'm interviewing, or even medical students when I was on the residency committee, with what sport do you play and what has it taught you? Same question you just asked me. Because I think that there is such a strong correlation between achievement in sports and being able to handle, frankly, anything. Um, Being a triathlete has taught me almost everything I need to know about myself, in life, professional and personal. And I carry a lot of that with me through everything that I do. There is no question. I picked up triathlon because I was a lonely medical student. I couldn't commit to hockey anymore. I was a goalie. I wasn't able to join a team because if I didn't show up, then they had no game. So I needed to pick up an individual sport. And then I realized that this is not an individual sport. I joined clubs, I played along with people. And being able to push your body further than you thought was possible teaches you so much about yourself and what you think you can't accomplish, and then you do. So yeah, absolutely, no question. And it doesn't have to be a specific sport. There are some of my staff who are professional dancers, and it's taught them so much. And I see it. I see it in the way that they carry themselves, in the way that they approach people and other employees. It's so important.
Do you still find time to be active?
You talked about my ideal week. In my ideal week, which happens quite frequently. I jog to work. I live 6 kilometers away. I guess that's 4 miles. So I jog to and from work every single day, which allows me to get about 50 kilometers a weekend, which is great. I think that I don't run for the joy of it. It definitely gets my blood pressure up before I get to work, and it makes me feel much more awake. So I love that aspect of it. But I just love accomplishing things. So, training for, hopefully I get a spot in the London Marathon. I'm working on that in April. There's always something that I'm training for, always a hurdle that I'm trying to tackle for sure.
That's actually our anesthesiologist. She's an avid marathoner.
Mm-hmm.
She's always flying to some country, running some incredible race. So she did the London Marathon, I think, previously.
I'm jealous. It's hard to
Um,
get it.
yeah, I think she's really good. Or I know she's very good. What Rounding out our interview here, what are some things that you're looking forward to in the future, either for you professionally, for your office staff, for your patients? When you go to bed at night, what are you excited about?
Yeah. Um, Full scale facial rejuvenation, which does not just involve the surgery, but every aspect of preparation and post operative recovery. And whether that's in my current space now or something a little bit bigger, Dominic Bray, who I visited with a year and a half ago, does this, I think, better than anybody else. But to be able to cover every logistical concern for your patients, whether they are coming in from out of town or even locally, by allowing them to stay for a prolonged period of time in your center, by treating them with hyperbaric oxygen and red light therapy, even IV drips, whatever it takes to allow them to heal even better, to improve the surgical foundation that you just laid, I think really would allow me to become a destination for facelift, at least in Canada. That's what I'm constantly working for on a professional basis. Personally, we touched on this. It's balance. I want to be able to give as much to my family and to my friends as I do my business. And that is not going to always be a constant ratio of 50-50. I know some things are going to require more attention on either side, but I just want to be more conscious of it because success in a professional realm when shared with nobody is worth nothing. Who cares? I don't care how much money I made last year. I don't care how many noses or faces I did last year. I love the relationships I developed with my patients. I think that really carries me forward. And you don't have to have 100 interactions with happy people to feel that fulfillment. I really want to operate on the patients that I want to operate on so that I can go home and give my best self to my family.
Dr. Mike Roskies, where can people find you if they want to follow you?
Instagram, Dr. Mike Roskies, TikTok, TikTok Face Doc, drmikeroskies.com. And yeah, that's it.
Perfect. Thank you.
My pleasure. Thanks, Lauren.